The less support parents get from their families and the government, the more likely they are to think about giving up their babies. The DG Murray Trust helps children to grow up healthy. The Trust is pushing for a maternity support grant. I'm joined by Liezel Engelbrecht, the Trust's nutrition expert, to explain why. Liezel, thanks very much for your time today. What is a maternity support grant and what would it look like?
It's a form of social protection for women during the most vulnerable period of their lives. So we are advocating for the maternal support grant to be provided to eligible women from the second trimester, and that will be provided to them on a monthly basis, like the child support grant, up until the child's third month of life. And that really is to help the women to have the right nutrition, to have transport, to have access to healthcare services, and really to help her and her unborn child to have a better possible start in life.
Is there any data that you have that shows that something like this would work? Is it, for instance, used elsewhere?
Well, yes. So actually, about 30 countries have some form of social protection for pregnant women. Mexico, Peru, India, Indonesia. And what they've shown is really improved benefits for maternal health, decreased risk of low birth weight, decreased risk of maternal mortality. So quite a strong evidence base that the maternal support grant would be something to help vulnerable women and children. There was a cost-benefit analysis study done last year from one of the researchers at Wits University that showed that a maternal support grant could potentially save 13.8 billion rand in healthcare costs alone. And that's mostly linked to things like low birth weight. The risk really is reduced a lot if the mother is properly supported during pregnancy.
So why don't we have it?
You need some form of coordination, strong political will to make this happen and to push this forward. And it has so much potential. For example, about 20% of stunting can be prevented through maternal nutrition. So, that's a big number because we know low birth weight babies are almost 3 times as likely to be stunted by the age of 2 years.
Why is stunting so bad?
It's a form of chronic malnutrition. So it's persistently not getting the right types of food. So it's not only about not getting enough calories, but it's also about getting those essential micronutrients, iron, vitamin A, B vitamins, all of those things that's really necessary for growth and development. And unfortunately, if the mother doesn't have that, that means that the unborn baby, the fetus, doesn't have that either.
There are so many things we need to pay for. Why would a maternity support grant be considered more important?
This is a relatively small investment to be made that can really have positive long-term consequences, benefits. One low birth weight baby is estimated to cost the healthcare system approximately 250,000 rand. Just the cost of care of the baby alone. So that's just healthcare costs, and it's not counting in the opportunity cost. For example, if we look at the child support grant, what benefits that has had, there's increased benefits in nutrition and education and health as a result of the child support grant. So, yeah, I think, previous evidence from the child support grant shows that it has worked. People are more likely to participate in the economy because of the child support grant. You can buy food, you can buy transport, you can buy electricity.
And yet, Liezel, there are still some people who argue that women get children in order to get grants, however small that grant might be. Why do you think there are still so many misconceptions about that?
Yeah, you're right, Mia. There is a lot of misinformation and misconceptions. But if you look at when the child support grant was implemented, we actually see a decrease in fertility rates. There's no evidence to show that a grant will increase pregnancy.
Liezel Engelbrecht, thanks very much for your time today.
Thanks, Mia.
That's our show for today. Follow us on social media, or if you have a story idea, email us on health@bhekisisa.org.